Hey, Psych 2 students, good morning. It is Monday, April 27th, and this is the live stream for the day as we continue on with our Psych treatment chart. So if you want to go ahead and get that out, we're going to be adding number 5 and 6 on the psychotherapy side, and then we'll be done with psychotherapy, and we'll be moving on to our biomedical treatments starting tomorrow, okay? So again, make sure you pay attention to your due dates for your psych disorder assignments, which are listed on Canvas. And then you have your psych treatments as well, okay? So we're getting close to the end. Seniors, you have less than 2 weeks, I think, don't you? A little bit over 2 weeks. Yeah, so it is ending soon, okay? All right. Okay, so again, you can watch the live streams to get number 1 to 4, okay? And again, we're on the psychotherapy side, so these are prescribed talk therapy method and procedure for treatment of mental illness, okay? So again, remember these are, it generally means talk therapy, but again, there are many different types of psychotherapy, which we have seen. We've talked about 4 of the big ones here. And then each one has a prescribed method and procedure to help the individual get healthy. Okay, so generally I put prescribed in there because it is kind of like a prescription. You're going to use the type of psychotherapy that will best help the client or the individual with whatever it is they're dealing with. And each type of therapy kind of has its own niche, if you will, its own area of expertise, or what it definitely treats the disorders or mental illness really well, okay? Number 5 actually is the number 1 therapy used today, which is called CBT. Okay. Which is called cognitive behavioral therapy, CBT, okay? And it's a combination of cognitive, thinking, and behavioral. So what you're going to do is simultaneously in this therapy technique, you're going to combine cognitive with behavioral. Okay, so I'm going to look at unhealthy thinking, but I'm also going to look at environmental influences. Okay, so I'm going to look at them constructively together and kind of combine those 2 perspectives in a therapy technique that will then best help treat the individual. Okay, so because what we begin to find in the clinical field is that it's both of these are pretty huge factors and that they relate to each other. So if I have just some environmental influences on my mental health or mental illness, generally I have thoughts and perceptions about those as well, okay? And then same thing, generally if I have unhealthy thoughts, that creates environmental concerns for me as well. And so we're going to combine them together, because each one by itself was not adequate enough or not as good if I combine them both together, okay? And this was, I think it still is the number 1 therapy technique used in all of psychology, I think last year, and continues to be so. So cognitive behavioral therapy, I'm going to basically look at your thinking processes, identify the ones that are unhealthy, but I'm also going to look at your environment, and I'm going to use those 2 together to create to create and prescribe a treatment that's just more successful, more efficient, if you will. I know this is the number 1 therapy technique for anxiety and depression, which are the 2 big ones. I think currently there's still more anxiety disorders in our country that are diagnosed than any other. And then obviously depressive disorders are a close second, and those 2 really relate. Again, anxiety and depression relate biochemically in my mind. They basically operate on the same neurotransmitters. So they are very similar in biological mechanism, but also in etiology in dealing with thinking in the environment. Okay, so we're going to treat both of these together. because one exclusive by itself wasn't going to be kind of the best option. So we combined them two. And there are other therapy techniques. Again, there's going to be more therapy techniques than the 6 that we cover. They combine different ones. Psychodynamic actually is the new modern version of psychoanalysis, and it actually combines psychoanalysis with cognitive and behavioral. Okay, so and then humanistic is generally used in some way, shape, or form in every prescription of psychotherapy that we have. So you can use them individually. You can combine them. Okay, that's kind of what why I wanted to bring this one in here, so you can kind of see that I don't just have to stick strictly to one. Again, the goal is to give the patient health and to help them work through the issues that they have and to move them from mental illness to mental health. Okay, so whatever allows me to do that the best, the most efficient, the quickest, healthiest, most permanent way is what we're going to do. That's what we're going to go for. Okay, all right. So those of you who have experienced therapy, probably, if you ask your therapist, probably in some way, shape, or form, there's CBT involved, especially if it's anxiety and depression. Okay. All right. And the last one, number 6. And let me show you a close up of that real quick so you can write that one down. Okay. So number 5 is cognitive behavioral therapy. It started because it's currently probably the most prescribed therapy technique that we have. Okay, and it deals with combining cognitive, which is thinking, and behavioral, which is environment. So I'm going to treat simultaneously at the same time. I'm going to look at thinking processes that are involved, and then how those interact with your environment. Because we have found that, that actually one of the best combinations of factors that explain your behavior are the interactions of your thinking, your environment, and yourself. Okay, and that's actually Albert Bandura, reciprocal determinism. She has a little triangle there that reciprocates. So you have the environment, your cognitive, and you. I also think it's called the conative side. We have the conative side to us, which is basically the same thing there. And that's kind of so we have the environment, our cognitive, and our conative side. And that kind of gives us all a better look at who we are. So that's kind of where that comes from. Okay. All right. Number 6 is group therapy. Okay. And so group therapy, which we see in movies, TV shows, things like that, but we do know that there is healing, and the process of healing can be helped when we do it together. We do it in groups because it's good for us to know that we're not alone. And if you are trained in therapy, you're actually trained in group therapy dynamics. So it's a whole separate training that you have to go through, classes you have to take to be able to successfully run a group, but also to make sure that you make it healthy. So that it has a prescription technique that you're not just doing it so everybody can share, but also that you have a prescription, you have a method, you have a procedure to help everybody in the group increase and get better. Okay. Now, part of that is sharing with each other. So, there's a lot of addiction groups. I think in the past we've shown Avengers Endgame at the very beginning of the movie where Steve Rogers is running. He took over Falcon's group with veterans, and they're talking with how to deal with the snap, the post-snap life on the world. There's this group of men there that are kind of talking. PTSD, really big in groups. Okay, veterans that get together and share their trauma, their experiences, how the therapy's going, that could be said for just about any disorder. There are a lot of support groups. Okay, support group. If you hear, just groups that are there. So the dynamic. So what you have to be trained for there is just the dynamic part of it. It's not just an individual session. It's a group session, and groups are different than individuals. They have different dynamics. They have different variables, if you will, and you've got to make sure that you control all those and run the group, monitor the group, and also that you're in charge of everybody moving forward and getting health and getting better. Okay, but we do know that groups are very healthy, and they can be used outside of mental illness. So I know there's Alzheimer's groups, and generally there's Alzheimer's groups for the patients and their families. So a lot of times there can be groups for the family members of people who are dealing with mental illness or neurological diseases or illnesses. So on and so forth. So there is healing in groups, okay? And there's something beneficial about sometimes going through the journey with somebody else and with other people who are dealing with the same issues that you do. But I think the big influence on groups, especially in psychology, is that you're around people who have experienced. Okay, I think that's probably the biggest thing that I have found in my training is where groups come into play. Because, with some of these illnesses like anxiety and depression, if you haven't experienced that, there's no way to understand what it's like. There's just no way to let somebody, in and be able to fully explain what you're experiencing. But you can with other people who have experienced it with you. Okay, so, especially in psychology, there's a lot of strength and power in group dynamics because you're around people who have experienced what you are experiencing, where most of the population has not experienced it, and they don't know, they can't relate to what you're going through. And that's actually a good thing because, I know patients who have anxiety and depression who wouldn't wish that on anybody. And they're glad that people have not experienced what they experienced. But at the same time, they long to be around people who have experienced it so that they can work through it together and they can share what they're experiencing. And, a lot of times with like anxiety and depression, people isolate themselves. They don't share. But then this gives you an avenue. Again, it's very healthy to create a group, to surround yourself with people, to share. And this gives you a group to do that with that can understand and relate to what you're going through. And that's very, very powerful in group therapy, especially with the mental illness, because you just don't know what it's like to have the illness, the physical and the mental illness of anxiety and depression, and you can't relate to it if you've never had it. You just can't. Now you can be supportive and you can listen, but you can't really relate to it. You can still help the person, but you're not going to be as therapeutic as somebody who's actually experienced it and gone through it as well. And they can relate and bond, and then it creates just a great healing environment, which is also a big thing for groups. Okay. All right. So that's number 6. So there are 6 there. And then within group therapy, you can use any technique here. But the main difference in group therapy, again, is that you're just trained to deal with group dynamics. And, don't let somebody control the group. Don't let somebody dominate the group. Make sure everybody can share. If there are people that are uncomfortable with the group, just let them experience the group first. Everybody joins the group at different times, also physically, but also psychologically, and that type of thing. So, there's a bunch of things, but they are very healing, and our society uses them quite a bit. Our counseling office at the school uses them quite a bit. They offer groups every semester for students and also some for families, and so on and so forth. So a big part of psychology and treating and health, and again, that main factor here, which this has that no other else prescription or therapy has, is that you can go through it with people who have experienced exactly what you are experiencing. And so you don't feel like you're alone. You might have wonderfully supportive parents, and we need that through this process, but if they have not experienced it, they can't really relate to what you're going through. They can't understand it. These people can understand it. Even better sometimes than the therapist, because the therapist has always been mentally healthy. I remember experiencing that. I don't know what it's like really for you to go through it. But certain things I did. And that helped me be a better therapist. So, that kind of helps bridge that gap there a little bit with that as well, is that you have a therapist who understands what we need to go through to get healthy, but then you have a bunch of people who understand what it's like to actually be sick and to experience the symptoms and things that you are experiencing. And you kind of bridge those two together. Okay. All right. Okay. So that's the left side of the chart. We're done. Okay. There are your 6 psychotherapy techniques that you need. Okay. And then we'll start down here. And I think we're going to do 6 biomedical treatments. And tomorrow will be medication, which will be the longest one, because we'll go through the different types of medication that can be used and some of you can relate to, and maybe possibly if you or somebody on your family is currently prescribed them. So we'll go through medications, then we'll do stimulation, and then we'll do surgery. Okay. And then I think we'll be about done. So I think hopefully by Thursday, we'll kind of be done with the chart as well. And then it'll just be pretty much finishing your work and getting that in. Okay. All right. If you have any questions, email me, contact me, make sure you're working on your assignments, visit Canvas, and check off that list and get those assignments submitted. Happy Monday.